Welcome to this edition of the Health Policy Institute's update on the impact of COVID-19 on the dental care sector. This week, we are bringing you insights from the week of September 21st. My name is Marko Vujicic. We'll shortly be joined by Dr. Chelsea Fosse, who will be joining me to give us the main results from this week's polling. Today, we're going to do three things. Update on the latest data from the HPI Economic Impact of COVID-19 Tracking Poll, our core questions. Number two, we have a series of questions of the week that this round focus on stress-related oral health conditions of the patient base that dentists are reporting, as well as looking at measures dentists are taking to maintain financial solvency, some really interesting results. And as usual, we will also review the latest consumer polling data related to sentiment around dental care visits. We'll skip this. Hopefully you've been following. If you need the methodology, this is available at ada.org/HPI. Nevertheless, this is a robust survey of dentists that we've been doing every 2 weeks. And with that, let's dive into the results, and I'll turn it over to you now, Chelsea.
Great, thank you, Marko. So we'll get started with some of our core questions. First, we've been asking, what is the current status of your dental practice? If you move down to the bottom of the slide, you'll see the week of September 21st, where we have green as open and business as usual, yellow, open but lower patient volume, orange, closed but seeing emergency patients only, and red, closed but not seeing any patients. So as you can see, we have about 99% of dental practices open as of the week of September 1st. Roughly half of those practices are reporting business as usual in terms of volume. And as you also see on the slide, this really hasn't changed all that much over the past few months. Next, we'll look at patient volume. So how does this week compare to what is typical in your practice in terms of total patient volume? Again, I'll take you down to the bottom of the slide where you see the week of September 22nd, and you'll notice a couple different scales here. So we recognize that many dentists were reporting patient volumes at the 76% or greater level compared to pre-COVID. We wanted to get a little bit more granular data on this. So we've now broken down those segments into 76 to 85%, as you see in that army green, indicated by the 25.1 in that bottom bar. Then we have 86 to 95%, indicated by that forest green, and 32.3% in the bottom bar, and the more than 95%. So what do all these numbers mean? Basically, we're seeing patient volume in dental practices is estimated at about 81% of pre-COVID levels as of the week of September 1st. Nationally, patient volume seems to be leveling off. As you move back up the slide, you can see there hasn't been major shifts in these breakdowns. Next, we have, is your dental practice paying staff this week? So the green indicates yes, fully paying staff, yellow is yes, partially, and red is not paying any staff. Staffing in dental practices is stabilizing and was at about 95% of pre-COVID levels as of the week of September 21st. Now a couple questions for employee dentists. We've asked employee dentists or non-owner dentists, are you being paid this week, which is the graph you see on the top portion of the slide. The green indicates yes, fully, yellow is yes, partially, and red is not being paid at all. You can see that less than 80% of employee dentists were being paid fully as of the week of September 21st. So employee dentists seem to be having a lingering employment effect. Then we ask those who are not being paid at all, are you currently receiving unemployment benefits? The green is, again, yes, I am. Yellow is, I've applied but haven't received any benefits yet. Red is no, my application was not approved. So among those who were not being paid at all, about 40% were receiving unemployment benefits. Now some questions on PPE supplies. We've asked how many days worth of the following PPE does your practice have at this time? You can see our categories on the left: N95s, surgical masks, face shields, gowns, and disinfecting supplies. And we go from 0 days in the red to 1 to 7 days in orange, 8 to 14 in yellow, and more than 14 days in green. Comparing this to prior weeks, there haven't been major shifts. The gowns, N95s, and disinfecting supplies seem to present the biggest challenges. Now we're going to get into a few of our questions of the week. So this first one is, compared to before the COVID-19 pandemic, how has the prevalence of the following conditions changed among patients in your dental practice? On the left, you see the conditions for which we've inquired: bruxism, chipped teeth, cracked teeth, TMD symptoms, caries, and periodontal disease. So those top 4 could all be stress-related. The scale you see at the bottom, we've got in turquoise, that lightest color, taking up the left portion of these bars, indicates that dentists are seeing an increase in this condition among their patients and their practices. The teal is stayed about the same. The color representing decrease is barely recognizable. There's a little sliver in some of these bars that you can see right next to the gray. And then the gray is not sure. So what does this graph tell us? The majority of dentists have seen increases, particularly in the potentially stress-related oral health conditions since the onset of the pandemic. So bruxism, chipped and cracked teeth, and TMD symptoms. More than a quarter have also seen increases in caries and perio disease among the patients in their practices. Now we're going to have a couple questions on financial sustainability. These questions were asked of owner dentists only. This first one says, since you reopened, have you taken any of the following measures to maintain the financial stability of your practice? Some of the options listed include downsizing a dental team, reducing dental team hours, reducing employee wages and benefits, disenrolling from dental benefits plans, changing your dental supplier or lab, raising fees, borrowing money from a bank, selling your practice, joining a DSO or large group, retiring, or other. The green indicates yes, that these measures have been taken. So you can see that dentists are taking various measures to maintain the financial stability of their practices. Most commonly to date are borrowing from a bank, raising fees, and reducing staffing. Now we wanted to look into the future a little bit. So we asked a similar question. Assuming your patient volume remains what it is through the end of the year, would you seriously consider any of the following additional measures? So these are measures not necessarily taken to date, but would be considered through the end of the year if need be. What you can see by the larger portion in green here is that if patient volume does not rebound further, dentists are likely to consider raising fees, reducing their dental team's hours. About 1 in 5 are likely to sell their practice, including about 1 in 6 who are likely to retire. When we looked at these results broken down by age category of dentists, we found that about 40% of dentists 65 and older indicate they would retire if patient volume doesn't rebound more than it has to date. This is information provided from the Centers for Medicaid and Medicare Services, CMS, that came out just last week. They provided information on the primary preventive and mental health services among children covered by Medicaid and CHIP. They compared the level of services received in March to May of this year compared to March to May of 2019. In that comparison, they saw that dental services dropped by 69%. This was a more significant drop than they saw for vaccinations, screenings, or mental health services, as you can see in the top right of this slide. All right, now we'll switch gears a little bit and talk about some consumer polling results we've seen. We've been partnering with Engages, a leading consumer research firm, and they've been conducting a survey of nationally representative sample of households. One question that they've been asking for some time now is, which of the following conditions is closest to your current point of view regarding visiting a dentist's office? So in the upper left, we have recently active. This represents 24% of the folks in this panel have already been back to the dentist. Another 55% say that they are ready to go. They're ready to head back. 7%, that yellow sliver you see, are those who are assurance seekers. So they might need a little bit more comfort in some way before they're going to head back to the dentist. And lastly, in red, we have those who need a medical breakthrough. So 14% are going to need some proven therapy for COVID or a vaccine before they head back to their dentist. And all of the households or individuals represented in this pie are those who are dental utilizers. They're folks who had been to the dentist pre-COVID in 2019. So what does this tell us? If we remove that 14% red piece of the pie, need a medical breakthrough, then we get at about 85, 86% of folks who are more or less mobilized and ready to return. So the upper bound of what we could expect in the near future in terms of patient return to practice is about that 85% of pre-COVID levels. All right, so some key takeaways just to summarize the data we have from the week of September 21st. Recovery, we are seeing that 99% of dental offices in the US were open as of last week, and patient volume was at about 81% of pre-COVID levels. Staffing is at about 95% of pre-COVID levels, and all of these numbers are largely unchanged. We're reaching that steady state. Looking at oral health issues, the majority of dentists, as discussed earlier, have seen increases in among their patients in stress-related oral health conditions since the onset of the pandemic. Those include bruxism, chipped and cracked teeth, and TMV symptoms. Additionally, more than a quarter are also seeing increases in caries and perio disease among patients in their practices. Public perception. So our consumer polling shows that about 80% of people who regularly visit the dentist prior to the pandemic are comfortable visiting the dentist today. Another 7% would be comfortable with a bit more assurance from agencies like the CDC or the ADA. And we have about 14% who report that they're not going to be ready until there's a vaccine or treatment for COVID. Measures taken for financial sustainability. We've seen that dentists have already taken some measures to maintain the financial stability of their practices, including borrowing from a bank, raising fees, reducing dental team hours, or downsizing their dental team. A much smaller share of changed suppliers or labs are disenrolled from dental benefits plans. Looking at future financial sustainability, if patient volume does not increase by the end of the year, many dentists will consider taking additional measures. The most common responses included raising fees, with over half considering that option. About a third would reduce their dental team hours, a quarter would consider changing their supplier or lab, or disenrolling from dental benefits plans. About 20% would consider selling their practice, and 8% would consider joining a DSO or large group. Given that patient volume is unlikely to change considerably in the coming months, we are likely to see many of these measures play out. That concludes our information for the week of September 21st. Thank you so much for listening and joining in. We look forward to seeing you in the future. All of this information can be found online at ada.org/HPI, and you can find our slide decks, past presentations, and reports from the COVID polling. Thanks again, and we hope to see you soon.